most commonly be in the aorta, perhaps in the region of where the kidney arteries are, although it could be even higher up into the chest area. So in those particular cases, the repairs can be more complicated, and we might approach it differently than we would a typical aneurysm below the kidney arteries. This operation, the traditional operation, as I said, is basically a curative operation. One of the downsides of that surgery, however, has been the fact that most people we do this on are not young. Most people are in their 70s and 80s. Those are the two most prevalent decades that Dr. Wolkin and I see patients with aneurysms. And a major abdominal operation is a big operation for a patient in this age group to go through, even though the operation itself is very effective. Typically it involves about a week in the hospital, usually the first 48 hours in the intensive care unit, but it is very effective once you get through the surgery in terms of curing the disease, but it also involves a considerable period of recovery. One of the advances, and this is what inspired us to give this talk tonight that has occurred, is the development of repairing these aneurysms with an endovascular approach. A lot of people are familiar with balloon procedures such as angioplasty and hear the word stent, and indeed stents are being placed frequently in coronary arteries in the heart circulation. Well, as sort of using that technology and trying to find other utilizations of it in the body, one of the things that has developed in the last several years is the development of a stent graft approach to the repair of these aneurysms. And that's what I'm going to talk a little bit about here. Basically, the picture here shows a stent graft, and what it is, you may say, well, boy, that looks a lot like what you showed on this prior slide, and that is a Dacron graft within the aorta. And in fact, this is one particular stent graft, this being another, and both of these really are Dacron grafts inside the blood vessel. The difference with this, as opposed to opening the abdomen and hand sewing a Dacron graft into the aorta, is we actually are able to deploy these devices through incisions in the groin, through what we call femoral artery incisions. And it's commonly talked about that these are stents, and indeed these are a development of stent technology. We call them stent grafts or endografts, and the reason we call them that is because they actually are Dacron grafts. They're polyester fabric, but they are supported in some way and are actually placed through a groin approach as opposed to opening the abdomen, and that's really the beauty of them. This particular device here is a device that, again, is a Dacron fabric, but has a nitinol, which is a metallic skeleton, if you will,